This is the room I'm doing my assessment in. She's going to record. This is going to be my patient. And this is the rest of the room. Okay. Hi, my name is Rashmi. I'm going to be your nurse today. I'm going to close this curtain for privacy. Can I have your name and date of birth, please?
Matthew Joseph, 8/24/66.
Okay, thank you. Today I'm going to be doing a head-to-toe assessment on you. I'm going to wash my hands. Are you feeling any pain today?
No,
Any allergies?
no.
Okay, patient looks well kept, patient looks appropriate to age, and patient looks healthy. Patient already saved their name, so I know that they know who they are. Do you know where you are?
This is the basement room.
Do you know what day it is?
Wednesday.
And do you know what you're doing?
I think there is an assessment going on for you.
Okay. Okay. And now I'm going to go carry on with the rest of my assessment. Patient's skin is appropriate with patient's ethnicity and is good color. Patient is warm to touch. There's no lesions present. If there was, I would be looking for asymmetry, border integrity, color, diameter, and evolution of the lesion. Can you take off your glasses and look at your eyes? Okay, open your eyes. I'm looking for symmetry, presence of pupils, equality, roundness, and the size they're equal and they're equally about a size 5. I'm going to check for their reaction to light. And good. Now I'm going to check for your accommodation. Can you please look right here and follow it? Good. Now I'm going to pull down your eyelids and check your conjunctiva. Patient's conjunctiva are pink and moist with no drainage or signs of infection. Can you open your mouth, please? Check your oral cavity. There are, his oral mucosa are pink and moist. No lesions. Teeth are white. Gums, can you show me your gums, please? Gums are pink and moist. No retraction, edema, or bleeding present. Can you show me your tongue, please? No coating, no lesions, good position. Can you show me your throat? There's presence of uvula, no presence of tonsils. Have you had a tonsil remover surgery?
Yes.
Okay, thank you. And I'm going to inspect and palpate the patient's neck now, palpating for any masses. I'm going to feel for the carotid artery pulse. That's good. Okay. I'm going to listen for bruits, which I shouldn't hear any. Okay. There were no bruits heard, which is good. Now I'm going to check your skin turgor to make sure you're not dehydrated. Good. You have no signs of facial drooping, good facial symmetry. Now I'm going to check your cranial nerve number 5. Can you close your eyes? This is check his trigeminal nerve. I'm going to tap your face and I want you to tell me where you feel it, okay?
Forehead, nose, cheek, chin.
Okay, good. Now, can you smile for me? Frown? Puff your cheeks? And raise your eyebrows? This is to check your facial nerves, which is cranial nerve number 7. All are working good. And now I'm going to move on to your upper extremities. You can wear your glasses if you want. I'm going to check the patient's brachial pulse. Hold on, I'll just do it together. Both brachial pulses are equally bilaterally equal and grade of 2+. Radial pulses are equal bilaterally and also a grade of 2+. Can you do a hand grasper for me? Okay, good strength. Nails are healthy, clean, and show no signs of infection or fungus. Capillate refill. Is good and within 2 seconds. Skin on hands is a good color for ethnicity, warm to touch, no signs of lesions anywhere. If there was, again, I would be looking for asymmetry, border integrity, color, diameter, and evolution of those wounds. Now I'm going to check his lung and thorax. So his chest wall appears to have no signs of lesions or scars. I would be looking for them, but he has a shirt on. Then I would be feeling for his aortic. His aortic area is in the second intercostal space. His pulmonic is on the right sternal border. His pulmonic is the second intercostal space on the left sternal border. The herbs or second pulmonic is in the third intercostal space of the left sternal border. Then is the tricuspid, which is in the fourth intercostal space of the left sternal border, and the mitral, which is in the fifth intercostal space of at the midclavicular line on the left side. S1 is heard best at the mitral, or the apical pulse is heard best there, and the S2 is heard best at the aortic area. Now I'm going to listen. No murmurs were heard. Now I'm going to go ahead and listen to his lungs. Can you take a deep breath for me? 1, 2, 3, 4, 5, 6, 7, 8. On your left side, I'm going to listen to 1, 2. On your right side, 1, 2. Okay, and then your back. 1, 2, 3, 4. Are you feeling dizzy or lightheaded or anything?
No.
Okay, good. 5, 6, 7, 8, 9, 10. Okay. All lung sounds are clear. Hold on 1 second. Now I'm going to percuss your costovertebral angle. Tell me if you feel any pain or tenderness.
No. No.
Okay, good. Now I'm going to check your posterior chest excursion. Can you give me a deep breath? Okay, that's good. You can let go. Okay, and then can you bend forward? I'm going to check your spinal curvature. The spinal curvature is nice and straight, and yep. Okay, we can. Okay, you can go on the bed, and we'll do your abdomen now. Put the knee down. Patient has no scars or lesions. Contour is round. I'm going to listen for vowel sounds, starting with the right lower quadrant for 5 to 20 seconds. Up to the right upper quadrant. And to the left lower quadrant. Okay. All quadrants were active. Now I'm going to palpate. Do you have any pain anywhere?
No.
Okay. I'm going to start with the left lower quadrant again. Here you would find the appendix and ascending colon. And in the right upper quadrant, you would find the liver and gallbladder. In the left upper quadrant, you find the stomach and spleen. In the left lower quadrant, you find the sigmoid colon, part of the stomach colon, the smaller intestine, and if there's a woman, you would find an ovary. Okay, you can get up. You can get back up here and we'll do your lower extremities. Okay. Patient's skin is good for ethnicity, skin is warm to touch, no signs of any lesions anywhere. If there was, I would be looking again for asymmetry, border integrity, color, diameter, and evolution of the wound. I'm going to check for edema, and neither leg has any pitting edema. Cap refill is all good within 2 seconds. Dorsal pedis pulses are both 2+ and equal bilaterally, and posterior tibialis pulses are equal bilaterally and grade of 2+. Yeah, that's it. And then now we're going to do the get up and go test. So you can pull those down. And I want you to sit back down. And when I say go, I want you to walk to the end of the room. I'll walk with you, and I'm going to time you. Just walk normally, walk to the end of the room, walk back, and sit down, okay? Go ahead. Go. 1. It took him 16 seconds, and his gait and everything was normal. That's the end of my assessment.